Welcome to the Wild Wild West of healthcare, known as affordable senior housing. Why is affordable senior housing the Wild West? Because much like the Wild West, providing healthcare and improving outcomes goes by a totally different set of rules. And so why do we care? Because our government doesn't have any money. We're in a budget crisis, and our budget crisis is a healthcare crisis. And if you know anything about who spends all the money in Medicare, there's a very small percentage of Medicare recipients that eats the biggest part of the Medicare pie. And many of those individuals happen to live in affordable senior housing, HUD subsidized and low-income housing tax credits. Who lives there? The profile of a resident who lives in our buildings is a 79-year-old widow who makes about $14,000 a year. 40% of them need assistance with ADLs. Mostly they're much more frail than individuals who live in the community because their entire lives they've had less access to health care, which makes them even more frail today. So you got to ask the question, what are the challenges? How do we actually provide health care and improve those individuals' outcomes? Well, at the top of the list is we don't know what we don't know. Initially, that's, you just see people in their apartments, you don't know their chronic diseases. And the reality is we've got the good, the bad, and the ugly. The good is we can make a profound difference in people's lives. The bad is they usually don't trust us. And the ugly is that many times other healthcare providers negate them because they live in affordable senior housing. Number one, this is not a healthcare model, it's a social model. What does that mean? People come and go as they please, not like a skilled nursing facility, and certainly not like an assisted living or a hospital. So we don't always know where our residents are. They could be at their daughter's in Des Moines, they could be in the community room, or frankly, they could be in their apartment hunkering down because they're afraid they're going to fall or they're very frail. So we don't know where they are. That's number one. Number two, there's a profound mistrust. They all think we want to send them to the home. Everyone gets to go to the nursing home, whether it's the property manager, the owner, their doctor, everybody has to go to the home. And we all know that that model is no longer sustainable, but there's a profound sense of mistrust. And these adults aren't used to dealing with a more futuristic approach to things. What they do instead is they worry about how they get through the day or the week. Do I have enough food? Not how am I going to be much healthier 6 months or a year from now. So how do you overcome these issues? Number one, information, as we all know, is power. And information that can transform someone's life is even more powerful. And I want to talk about a development at National Church Residences, Care Guide. Care Guide is a software solution for independent housing where we have non-clinicians who ask important information of the residents, and we can then develop a care plan based upon their chronic diseases, based upon their ADLs or activities of daily living that then can transform their lives. We stratify them, red, yellow, green, much the way a patient-centered medical home would. You caught that, right? Well, the reality is that is the flag of Bolivia, just so we were clear. But they're stratified. The very highest risk folks get even more. Little things mean a lot in affordable housing. Balance issues, if they're caught early, mean no hospitalization for a broken hip. Medication management early means we don't have that issue. Then we don't worry so much about readmissions. We talk about an initial hospital admission. We stop the initial hospital admission. We call it our pre-acute approach to health care. If you stop the admission, you're much better off. And we do that identifying the little things. And should one of our residents go to the hospital, we have a community nurse that follows them through the continuum so that they are advocated on their behalf, they're educated about their options, and other healthcare organizations don't negate them because they're from affordable housing. What have we found? We found we reduce hospitalizations, we empower those older adults to live longer where they want to live, which is in their own homes, and we also have reduced placement in long-term care facilities. Now, of course, everybody asks the question, is this sustainable? And frankly, right now, it's not. HUD pays us for a little bit. We get a little reimbursement for some skilled nursing services on the back end, but right now, it is not currently sustainable. We suspect it will be when we move into a shared risk, shared value policy. There are no silver bullets to the healthcare crisis. However, what there are is information like Care Guide that can transform an individual's life who is at greatest risk. And we at National Church Residences, we take great pride in the fact that we transform vulnerable people's lives to improve the overall community. Thank you very much.